Hi there, welcome back to my channel. Today we'll be having a chat with Dr. Prashanth, a leading pediatrician from Cloud9 Hospitals and my children's pediatrician too. Thank you, Dr. Prashanth, for joining us today. Is there any scientific reason behind saying that the third wave will be worse on kids?
So, like we were discussing, this now pediatric population is gonna be vulnerable if you put it like that. When we started the disease, we were calling the high risk group is the elder people at home, the one with the heart problems, the one with the diabetes, hypertension, all those things, someone with the chronic medications, kidney and all. Now it is shifting towards pediatric, not because they are deficient or anything like that, because the other population is getting more and more immunized. So the only way to get more and more immunity is either half of your population or 70 to 80% of your population then gets immunity by either natural infection or by vaccinating. So now we are focusing more and more on the adult population. Majority of them are getting vaccinated, like about 20%, close to 30% in few states. Now we should be focusing more and more on the vaccinating the younger kid, because they are not vaccinated, and so far there hasn't been many cases in them. So definitely the natural immunity or herd immunity, what we call, as well as the immunity because of the vaccination, both are still lacking in pediatric age group. So the focus should be more on vaccinating the pediatric age group now. So that's the only way we are going to protect them. Yes, like I have been mentioning repeatedly, yes, they are likely to get infection, but they might not suffer the very bad diseases. So don't need to really panic, but yes, take all the precautionary measures.
How airborne is this disease, and especially this variant? Many of us are worried because we stay in apartments or close by houses, and if somebody in our apartment or in our community gets this disease, we are all worried that we may also get it because this travels through air to some extent.
Airborne diseases. It doesn't mean if I'm infected here, that whole apartment complex, in the beginning we did, isn't it? Seal down, close down the apartments, close down the hospitals because one case was posted. And over a period we have learned that, it doesn't spread that easy. Otherwise, imagine one person affected in an area, the whole area is likely to get affected. It didn't happen that way. So every day we are going to learn more and more about it. But yes, you are going to have proper precautions. Make sure the close contact when you sit together, like in a closed room, you are sitting 6-8 people chatting and all those things can definitely go down. Even kids, it's very difficult to refrain them from hugging each other. Small kids, they want to play together and all those things. That becomes a little challenging. We don't know, as and when we learn more and more, we might understand more and more about it. Small kids, especially less than 1 year, 2 year kids, it's very difficult to put them on a mask, especially when they are running around all the time. They're going to have a little difficulty in breathing as well. So make sure your child is getting good ventilation rather than just kind of creating a smothering kind of an environment.
Are there any extra precautions we need to take for our children in an apartment? Most of us live in apartments and we have common areas, common play areas and whatnot. So what are the things we can do to make sure our children are safe in an apartment complex?
Have a good healthy environment, good cross ventilation, enough access to the good air, good quality of air. Be sure about the source of water, what you are using for the nebulization and all those things. Like I said, unless it is really necessary, don't keep on doing all these things, taking nebulization every day, this, that. It's not going to help you to a larger extent. Yeah. Especially if you are staying in a crowded places, it becomes even more important for you to have a good proper cross ventilation. People who stay in larger apartment complexes and all obviously will be expected to have more crowding and all. Make sure, I'm sure all the apartment complexes are having their own rules of not allowing people to gather, all those things, but still so you need some certain kind of a balance. You can't ask your kid to be indoor all the time 24/7. It's going to have an impact on their socialization, their language development. They need a lot of personal interaction. Playing with other kids is going to play a lot of important role in their development. And we are compromising all these things, obviously it will have an impact on their general development also. So make it a point, don't gather, don't create crowd, but at the same time don't compromise child on it's totally deprived of completely social activities. Not saying people outside at all, it is in a closed house for months or years. So only a child knows what is going to happen on him. So just make sure you are having a balanced thing, not taking risky things, not going to gatherings, not going to malls and all for sure with the crowded places, but at the same time making sure child is not stuck to screening, not stuck in front of TV, mobile, not interacting with anyone. That's going to cause even bigger problem than what we are discussing now.
Earlier, it was said that one of the preventive measures that you could take for COVID was steam inhalation. But now, with the advent of black fungus, it is said that too much of steam inhalation can ultimately cause black fungus. So, what is one to do?
See, we have a natural immune barrier. Our mucosa, right from the nose into the respiratory tract, it does a great job by preventing, anything that is directly entering into the lungs. So, which we call it as a natural barrier or the natural immunity against the possible any viral, bacterial, or whatever. Now, first thing is we have to keep this barrier healthy. So there are so many things to do that, be it maybe meditation, yoga, or steam inhalation, this, that, and all. Now, anything that is done in excess. So, see, people take out of context. Now, steam inhalation, all of us have been practicing for ages, isn't it? Whenever we have blocked nose or anything, it's going to keep it airway clear and all those things. But now, when you keep it doing day in, day out in a healthy person whose airways are as such clear, and you don't have a control on the temperature or the force with which you are taking the jet. Few people I see seeing in the news and all, they start using some jet nebulizer kind of thing to take steam and all. Obviously, it's gonna make your protectors, your barriers gonna weaker and weaker. You're gonna have a injury to your mucosal things. Any opportunistic infection can definitely pop up. So don't take them as the first line defense or the particular thing to prevent COVID and all. Those are all the home remedies to get rid of common cold flu like symptoms. Definitely not like you keep on taking steam every day and you will be not getting COVID. So be careful when you are practicing such things. Black fungus is something that is they're all becoming famous. All these things are becoming famous in the COVID era for all wrong reasons, obviously. Black fungus is something which is a known thing. So even when something is not used or when there is no good proper ventilation, when the body's immunity goes down and all, definitely we do see fungal infection. In fact, more younger the babies, we do see a lot of fungal infection in small babies, tiny babies in NICU and all those things. Obviously, when the host immunity goes down, so people are taking steroids, this, that, all those things are going to bring down your immunity. At the same time, they keep taking this steam. You don't know the quality of water, what they are using, the source of water, whether it is a stored water. That itself is causing a lot of things. So it is more like, doing things in a right way rather than finding out what is the right thing. Steam inhalation, keeping your breathing exercises, all those things will definitely make an improvement in the lung capacity, your natural capacity to fight an infection. But when you do it in a wrong way, definitely it's going to have its own impact. Don't keep on using all these humidifiers, this, that, or nebulizers and all unnecessarily. Yes, so it all depends on the environment. How bad is the weather? Depending on that, humidifiers are definitely going to be of some health benefit. But it also depends on what goes in, whether you are using a good water or you are using contaminated water. That itself will act as a source for some sort of infections and all that. So use the things in an appropriate way. Be it steaming, be it using humidifier, be it the cross ventilation, even the isolation also. Don't isolate in a way that you just don't want to inhale the outside air. You are causing more and more harm. Yes, people are worried that it's airborne diseases. Every season, every flu, tuberculosis, whatever we take, most of it is airborne diseases. It spreads by air. So, but we have our own. The virus has its own limitations.